Hello and welcome to This Is Your Brain on Drugs Psychiatry podcast. I'm your host, Dr. Cody Armstrong. This is going to be the first episode, as you'll obviously see. I've never done anything like this before. I think I've got some interesting information to convey to those of you out there, and I wanted to use this first episode kind of as an introduction to myself, to what the podcast is about, to kind of give you an idea of who I am, what we're going to be talking about, how things are going to be a little bit different than maybe other podcasts, and as well to kind of give myself a way to, make an episode and see if I can make all this podcast stuff work. So here we go. So like I said, I'm going to introduce myself, the format, my philosophy, the target audience, where I get my information from, how this differs from other podcasts that are out there, and then some topics that we're going to cover on this podcast. So this is me, a drawing my daughter did of me, and you can see me if you're watching on YouTube. I'm going through slides while I'm presenting this information. It makes it easier for me to, stay on topic. It makes it easier for me to have you kind of follow along on the YouTube channel as well. So for those of you that are not watching the YouTube channel, I am talking about slides and referencing slides in the podcast. So as I said, my name is Dr. Cody Armstrong. I went to my undergrad at the University of Texas at Austin. I got a bachelor's in business administration with my major in management information systems. I graduated summa cum laude in 2001. I joined the Air Force as a communication and information officer after graduation. I served 5 years in the Air Force. I then, while I was in the Air Force, kind of decided, hey, maybe I want to go to medical school. So I got out, took some classes, got into school, ended up going to the University of Texas Medical Branch in Galveston, Texas, got my doctorate in medicine in 2012. And during my time there, decided I wanted to be a psychiatrist and was accepted to psychiatry residency program at Naval Medical Center, San Diego. I had, during med school, decided to get back in the military, this time the Navy. And so I went with the Navy and went to Naval Medical Center, San Diego, and finished in 4 years. Took my board exam and became board certified in psychiatry and neurology in 2016, and went to Okinawa for a number of years. And then I finished my 20 years of military service in Portsmouth, Virginia. And a lot of the material I have, I made for students that I taught these classes to. So it's a little bit about me and my experience. So I have 16 years of medical knowledge and experience through all those things I mentioned before. I've worked in inpatient environments, outpatient, consult liaison, substance abuse. So basically all, facets of adult psychiatry. I've done a little bit of child and geriatrics, but just some rotations during my residency time. And of course, I have seen a few patients outside of the adult population, but the adult population was my major population in the Navy. I was an assistant professor at the University Services University of Health Sciences for 4 years. I was an attending physician and educator of medical students, residents, and fellows when I was at Portsmouth. I lectured on psychopharmacology and addiction psychiatry there. I've published 4 peer-reviewed articles in medical journals. I've done extensive experience, being that I was in the military and I was dealing with kind of a younger, healthier population. What I saw was probably a bit different than what a lot of you all out there that are psychiatrists or in mental health have seen. I had a huge concentration on PTSD. So I think I saw a ton of PTSD. I saw a lot of ADHD, a lot of adult ADHD, a lot of depression, anxiety, symptom disorders. While I did not have a ton of bipolar and schizophrenic patients, there were several of them, but I saw a lot of new cases. So being that I was working in the military with a young population, and we keep a close eye on our folks there. I saw a lot of new onset mood disorder and psychotic disorders, and quite a bit of substance abuse issues as well, but with more of a leaning towards alcohol and less of other drugs. But of course, saw that as well. Currently, I retired from the military a year ago, and I'm looking at doing some fellowships in lifestyle medicine, obesity medicine. So those are some fields I'm interested in learning more about, and I've been educating myself on for the last couple of years as well. So what is this podcast about? So first of all, it's a one-man show. It's just me. I don't have a co-host. I'm editing my show. I'm writing all the material. I'm in the podcast. So basically, it's all me. And so I apologize if it's not, as polished as maybe some others are. I'm doing my best. Another thing is I'm taking kind of a lecture format. And so what I notice a lot of podcasts, and I like these podcasts, they do kind of topics on their episodes. What I really wanted to do was teach psychiatric medications in easy, concise, digestible pearls, everything you need to know about these meds, and kind of go through it systematically, so that those of you that need a refresher, or you're learning this stuff for the first time, or you're a patient and you're trying to get information, it's going to be very organized, right? And so I'm going to cover all the psychiatric medications methodically by class, and we're also going to cover medications that are related to mental health symptoms. So those might be high blood pressure or constipation. So symptoms that might be related to mental health or might be side effects of medications we use. I want to get into those topics as well, not just psychiatric medications. I want to give the whole picture of when we're treating mental health, what we're doing. And so, we're going to talk about thyroid disorders, lots of topics like that. And so we're also going to talk about medications that treat the adverse effects of the medications and drug interactions that have to do with those. So a big, wide scope. But we're going to be concentrating on pharmacology. So that's another thing I want to make. I'm not going to be talking about therapy in this podcast. This is going to be a drug-related podcast. So we're going to be talking about psychiatric medications, when to use them, when not to use them, which ones to use, when to switch, everything about meds. And so I want this to be a completely med-focused. We will go into kind of how to diagnose and the diagnostic criteria of the illnesses, so that we know kind of, first we need to know what it is that we're going to treat before we pick our meds. So I want to kind of briefly go over like these are the symptoms of these disorders, and these are the meds that I would use to kind of combat those. So we'll briefly talk about the disorders that we're treating, and then we'll talk about the medications. I also would like to do some update episodes. So I'm first going to go over antidepressants, because I think that is the most common thing that every doctor, and it's the most commonly treated psychiatric disorder and the most common medications. So I want to hit that one first. And so if there's things that I learn or that come out, or new drugs that come out, or things that users tell me about that they found problems with the episodes and I made some mistakes, I want to make some updates. So I might throw in some shorter update episodes to say, hey, to kind of piggyback off what we did in the antidepressant episode, this new medication came out, or this new study came out, just to kind of have that up to date. And if I get a lot of questions from the audience, I want to make some purely Q&A episodes where it's like, hey, I've been getting a bunch of questions. Here's a list. We're going to have an episode where we just answer questions. And I only want to get to questions about episodes I've already done. So, if we've done the antidepressant episode, now we had some questions. Let's answer some of those, because maybe I didn't answer everything fully in the episode, to kind of be for completeness sake. And I have a website, www.punkrockpsychiatrist.com. And on that website, you can find links to episodes, links to YouTube, links to Instagram, all that kind of stuff. And like I said, some of you, if you want to watch the YouTube videos, you can see the slides that I'm presenting at the same time as the audio. And whether you're watching it on YouTube or on the podcast app of your choice, you'll be able to go to the website and actually get those slides for free so that you'll have them to use in your practice. I also plan to do Instagram and TikTok. I guess TikTok's kind of up in the air right now with, the US deciding whether they're going to allow it or not. But I do have an Instagram at punk_rock_psychiatrist, where I want to dedicate that more to lifestyle medicine stuff. And I kind of had a thought that if this podcast goes well, I might make another podcast called This Is Your Brain Not on Drugs. So to cover things, treatments that are more lifestyle medicine type stuff. So what is the philosophy of this podcast? What's my philosophy? So you've already probably noticed if you're watching the YouTube channel that I've got a punk rock t-shirt on, I've got a mohawk on, and if you're listening on the podcast audio, you'll hear punk rock music as my intro and outro music. I've always been a fan of punk rock music, particularly like skate punk music. And I've always kind of identified with the punk rock ethos. And so I think a lot of you might be saying, oh man, this guy's punk rock, psychiatry, does that really mesh together? They're really stuffy kind of folks. Or, maybe I want that stuffy folk. I don't want someone who's like all like punk rock and chill and stuff like that. But I think that's where this podcast kind of differs from a lot of other ones. So I think of punk rock ethos as like 4 main kind of pillars. And so first, nonconformity, anti-authority. So that means that doesn't mean, just destroy things, what you might be thinking what punk rock is. It's really kind of not just following what other people say and do because that's the way we've always done it, or that's what the studies say, or that's what, my teachers in school 5, 10, 20 years ago said. It's, it's about questioning everything, thinking critically, not conforming when it makes sense to conform, but not conforming for the sake of conformity. And not just, when I say anti-authority, I don't mean like, chaos and anarchy and stuff like that. I mean, not saying, if you're in an authority position, you have to earn that respect. You don't just, as a virtue of you being in an authority position, doesn't mean that you know more than somebody else does. And so it's I think about it as keeping us more on a level playing field and doing what makes sense. And it's doing what's right and what's truthful, and not necessarily, what everyone else is doing. And so pillar number 2, anti-corporate greed. So I am, one big difference with this podcast is we're not going to have any ads. We're not going to have any sponsors, and there's not going to be any influence from the pharmaceutical corporations. So I'm not making any money off of this. I don't want you to have to listen to ads. I don't want you to have to pay for premium content. I don't want you, I don't want sponsors to be giving me money that I'm then expected to give you some sort of message because I'm getting money from them. I want this to be easy listening, free, no interruptions, no outside influence. I don't want, drug companies or insurance companies or whatever it is who are not necessarily telling us the truth. They're just telling us what they want to make money. And that doesn't necessarily mean that they're bad or they're wrong, but it means that if you're doing something just to make money and you're not actually telling the truth, I want to go around that. I don't want there to be a slant here. There's no agenda that I have other than giving you the information that I personally have researched and believe is true. And I don't want any corporations coming in and influencing that. And so I think that is something that you can come to expect here. And that might be different than a lot of other podcasts. And those podcasts are still good, but I do often sense a hint of outside influence and subtleties in there where, maybe I'm not getting the right information because somebody else is trying to make money off of things. Or maybe the person, that's running the podcast, they're trying to make money. And so they're trying to be a little more sensationalistic, a little bit more like, oh, look at this. This is, interesting, over the top kind of stuff. But is it real? Is it true? I don't want that coming into this podcast. Pillar number 3, anti-consumerism. So I'm not selling anything. There is no merch. There are no books. There are no study guides. There's no self-enrichment by me. I have bought the website. I have bought the software that I make this podcast on. I own all my own equipment, the microphone, the laptop, my headphones. I purchased all this. It's not that expensive. I'm not making any money off of this. I am losing money on this. And I will not be asking you to pay for any premium content. The only exception that I might consider is if I ever get to a point where I offer CMEs and that's costing me, I would just charge you what I'm being charged to offer you the CMEs so that you can get the CMEs. But that would be something more down the line. Pillar number 4, DIY. So I'm doing this whole thing myself. I already mentioned that before. It might not be as polished or professional as other podcasts are. And it's because I'm not a professional speaker. I'm not a professional journalist. I'm not a professional podcast maker. I have never edited anything before. I've never done this before. It's scratch made, it's raw. And I hope that that's something that can be overlooked and appreciated for what it is. So, I mean, I've kind of said all these things that like I'm not doing that a lot of other folks out there are doing. And this is costing me time and money. So what the heck am I doing here? Like, you must be thinking, well, what's my angle? Why would I do all this out of the goodness of my heart? So I would say, not everything's about money. Like, I've made money. I get a pension from the military. I have investments. I don't feel the need to make money from this. I feel like I've taken enough from society over my life, and this is a way for me to give something back. And honestly, I get dopamine rushes from patients getting better. I get dopamine rushes from, people understanding and learning from what I've learned. And if I can touch patients that I don't even see through information that I provide to you on the podcast, then that's the reward for me. If patients are getting better treatments because you learned something that you didn't know before, and that's my reward. We do lots of things not for money. Like, I love gardening. I love doing things by scratch. I started raising chickens. It's one of my lifestyle medicine principles I'm doing for myself. I like to, make my own food, and I do this thing because I enjoy it. Like, it's a lot of work, but it provides me a lot of fulfillment. And so also, like, we're going to be talking about drugs a lot in this. And I know these drugs get a lot of bad press, and there's a lot of people that think negatively about them. And I don't want you to think that I'm just some sort of shill for like drugs. Like, I actually don't, people come into, I think practice in the military and practice outside the military are very different. You've got a system where you're making money no matter what. In the military, you're getting a salary, and we can go off label pretty easily, and our insurance covers it. In the civilian sector, people are trying to attract patients. They're trying to attract business, and sometimes I think they might give diagnoses or treatments or things, even like subconsciously without realizing it, because they know that, well, this person came to me for a drug, I'm going to give them one. I don't do that. I have patients come in all the time, and I say, I don't think you need any medication, all the time. And so there's nothing I love more than finding the right medication for a patient and then them doing better after they get that medication than they were before. But I get just as much satisfaction from someone coming in on medications that are making them worse or giving them side effects and getting them off of it. Or saying, hey, I don't think you need medication. I think, if you change your diet, if you did some more, use some lifestyle medicine type stuff, then that would help you much more and be more impactful. Or if you could go to therapy. I don't necessarily think that you need a medication. So we're going to be talking about how these medications work, but we're also going to be talking about when to use them and when not to use them. And honestly, I think they're overused. I think people are on way too many medications, and I'm hoping that by educating the listeners out there about these medications, that you're going to have a better understanding of when and when not to use. So how did I get interested in all this stuff? Right? Like, how did I get interested in medication so much? Because I think a lot of psychiatrists, they do a lot more therapy than I do, and they have more of a mindfulness for that sort of thing. And I never went into medical training thinking I was going to do psychiatry. I found medical training very difficult. Like, I was a very good student. I did very, very well in high school, college, but when I got to med school, it was tough. I was not at the top of my class anymore. I was probably at the top of the bottom half as far as grades were going. I struggled. I found internal medicine extremely complicated, and it was very challenging for me. I had a tough time with it, and I found psychiatry more digestible. I've got a very logical mind, and I think sometimes to my own weakness that I had too much of a logical mind. And so when I got into psychiatry and it was so fluffy and abstract, and I was like, wow, I don't know how to get my head around this. I had a tough time interviewing patients. I had a tough time making formulations and assessments. So I struggled in med school, and then I struggled like with psychiatry, and I had a new staff that he gave me this advice. He said, if you could just get good at one thing, you could stand out in that, and you could be the guy that's known for that. And around that same time, I was kind of looking at all these meds, and I was like, why do we have so many SSRIs? And why do we have so many TCAs? And like, what's the difference between all these? I was getting a lot of education that, they're not really that different. Just pick one. And it was interesting. In my psychiatry training, it was almost like learning about the meds. It was kind of like, well, these just all kind of do the same thing, and it doesn't really matter. And it's pretty. This part's pretty easy. And they spent a lot of their time teaching us about all the other stuff. And I asked a lot of questions about the meds, and a lot of my instructors didn't know the answers. I said, well, how is this drug different than this one? And this one affects this receptor more than this one does. Have you noticed that makes a difference for patients in any way? And they didn't seem to know. And so I thought, you know what? This is something logical and straightforward that I can comprehend. And I'm just going to I'm going to read every scientific article about these. I'm going to find every piece of data. I have the background information systems, so like I could build Excel spreadsheets and access databases, really, really well. And so I made these massive spreadsheets, and I, saw, okay, that's where this side effect is coming from, and there's where this might have this effect. And it gave me a way to kind of understand the meds and try and get better at picking the right med for the right patient. And as I got more into psychiatric medications and felt like I kind of understood all these aspects of them, I started to say, what about nausea? What about constipation? What about high blood pressure? What about dyslipidemia? What about thyroid disorders? And so I kind of looked at these chronic illnesses that the symptoms of those illnesses overlap with mental health symptoms, or they kind of go along with them, or, if you have one, you're more likely to have the other, or, a medication I'm using is causing this other thing. And so I started to learn more about those meds as well. And I did a couple of rotations at a school of pharmacy because I wanted to learn, pharmacists seemed like they knew everything. And I was like, they're there to check our work, but like, they're there to check to make sure we don't make a mistake. They're not there to, tell us something that we don't know. I feel like I should know the things that pharmacist knows. I should know everything about those medications. What if they don't catch my mistakes? And so I just wanted, and the thing is, the medications is really where you can hurt or harm help or harm a patient. You could kill a patient with medications if you don't do it correctly. And I've seen patients almost killed because of it. And I felt like, you know, psychiatric medications are in a category of medications that are quite dangerous. You know, I see cancer meds are pretty dangerous. HIV medications can be really dangerous. Autoimmune medications can be really dangerous. And so you had here a group of doctors, a psychiatrists that, from what I was seeing in my training, maybe weren't that as concerned or knowledgeable about the medications, but our medications are hardcore medications and they can really, do some damage. And so I felt like, man, I really need to know these. I want to know these as much as possible because I don't want to harm somebody. I want to help them. I want to give them meds that make their life better, not worse. And I think when, as a physician, you might think, I would get patients where they said their doctor said, oh, I don't, I can't do this treatment. And I think it's not so much as I can't as I don't know how. And that's okay. Not everyone knows everything about everything. That's why we have, specialists in things. But I wanted to know. And I feel like if you know the medications and you know how they work, you know the contraindications, you know where things can go wrong, then you can feel confident prescribing them. If you know everything bad that could happen and you know what to do to prevent it, and then you're gonna decrease your likelihood of causing those problems dramatically, and then you can feel comfortable prescribing those meds. And so I really fell in love with pharmacology just in general and from a physician's side. And so after I finished the military, I've decided that I'm going to volunteer and not work full time. But what I don't want this information to die with me. I want to pass all this information on, and that I thought the podcast would be the best way to do that. And so that's kind of how this podcast was conceived. So who's our audience here? Who's my audience? I want it to be anyone that's interested in medication. If you're a medical student and you're learning about psychiatric medications and you don't quite understand them, I want you to be able to go to the episodes about what you're trying to understand and listen to that and look at my slides and learn the material. That you should, if you listen to these episodes, you should get everything you need to know for psychopharmacology. There may be mental health questions on your tests and things that are like, what percentage of patients are this, or tell me about this disorder, or what gene, these type of questions we're not going to cover that much of. But if it's a med question, I would like to think that every single med question that you will ever have on any exam will be covered in these episodes. So for medical students, or you medical students interested in going to psychiatry and you want to get smart and get smart faster, listen to these episodes. If you're a resident, whether you're a psychiatry resident or a resident in another field, family medicine uses these meds, pediatrics uses these meds. Everyone uses these. Just as I prescribe medications outside psychiatric medications, most fields, especially those that are thought more in a primary care, so that'd be like, OB-GYN, internal medicine, family medicine, pediatrics, you're using these medications. And, you may not be getting that much information on them. I've met a lot of doctors in those fields, and, there's so much you have to know, so many things you have to know about so many different illnesses. You don't have a lot of time to learn about these medications, but these are some of the most common illnesses that we have. And if you're feeling, oh my gosh, I feel uncomfortable, should I send this patient to a psychiatrist? Can I handle it on my own? The wait for a psychiatrist is super long. I'm in the country and I don't have, my patients don't have access to a psychiatrist. Maybe you're a family medicine doc and you need to be treating bipolar disorder because there's just no one else to do it. And you never really learned about it. I'm hoping that you'll get that information from this podcast. And, if you're not a resident, you're a physician practicing and you're just interested in this, this is for you too. Nurse practitioners, physician assistants, pharmacists. If you're a pharmacist, pharmacy student or a pharmacist, and you want to learn more about these medications, I've gotten a lot of my information. In fact, most of my slides are based off of slides I got from a school of pharmacy and I built upon. So these are coming from a pharmacist standpoint. And so if you're a pharmacist and you want to learn more, I'm hoping that you're going to get all the information you're looking for here too. And then those that are affected by mental illness, whether that's, if you're suffering from a mental illness or a family member or someone you're close to, and you're like, I feel like I should know more about this med. I don't know if it's working well for them. I don't know, is this side effect caused by this? And you just want to learn more for your own, personal growth and to help out people. And, because doctors don't have as much time to like go over things, and they might miss something. And so if you can come with information and, I think a lot of the information that you're going to Google or go on WebMD and stuff like that, you may not be getting the best information. I'm hoping that this will be a place where you can get really good information and you can go in educated and say, hey, I heard that, it's pretty common to have this side effect and I'm getting it and I didn't mention it before. Do you think that could be causing this? And could we try a different medication if it is? So I'm hoping that that will also help those that are taking the medications, and just anyone who's interested in learning more. If you're not in one of those categories and you just, you think that these meds are the devil, I want to show you they're not the devil, and how should they be used appropriately? Almost every one of the medications we're going to talk to has its place somewhere, and we're going to talk about where that place is. A big thing about what I want to teach you is not just categories of meds, but individual meds. What are pluses and minuses of each med? When would I use this med? When would I not use this med? When would it signal to me to change the med, right? I want to cover all those things that you're like, I didn't get this in my training. I can't find it in books. Here you have an experienced psychiatrist that is giving you real world, I'm not going to be reading off the scientific literature, but this information is based off the scientific literature. This is not just crazy stuff that I'm making up and like, this is my own crazy stuff. This is based off of my personal experience. I think I'm going to cover that on the next slide. Where am I getting this information from? Right? This is not just my own thing, right? I got this material from lectures, from my own education, my own residency training, from reading journal articles, from reading expert opinions, like websites like Up to Date, other podcasts. I've gotten a lot of information from other whenever I learn a new piece of information from any source, whether it's from something I read or hear, I always check to make sure, is that, accurate? Is this something that's real and true? And then I add it to my material. And so it gets incorporated in there. As I said, I published 4 papers. So I've got some of my own research, and I'm going to talk about things that I've learned from my own research, but not just published research, my own personal clinical experience. I've through medical school, residency, and beyond, I've been doing medicine for 16 years. And so I've seen hundreds and hundreds of patients. And I think a big thing with psychiatric medications, we get hung up on, is it FDA approved for something? Is it, did this scientific paper prove that it works for this? And people are so different that you can't just say, okay, well, this paper said that this treatment doesn't work. Okay, it didn't work on a randomized controlled trial of hundreds of patients on average, but did it really, really work for like 10 or 15 of them? And that just got watered down because people are different. That's something I think people dismiss a treatment because, the research will say, oh, that didn't work. Well, it might work for some. And it's, if nothing else is helping them, I mean, I would certainly go with the most proven thing first. But if we've already tried that, I'm not going to not try something because, it's the literature says that it doesn't work. Well, does the how do you interpret that literature, right? There could be good information buried in there, or it could have been done. The experimentation could have been done in an improper way. It could have been funded by some company, and everything was skewed. Every patient is different. Everyone's brain is wired differently, and I like to try to take all this information I have from all these sources and the patient in front of me and make my best guess. And then based off how they respond, tweak it the next time, because I can't guess right every time. This is, psychiatry is an art and a science. And I think all medicine is, but almost particularly psychiatry. And so you've got to kind of find the balance of that. And don't dismiss something because of X, Y, and Z. Try it. I have patients that I've only given this one med one time, and it worked wonders for one patient, and it might not work for anyone else, but it's worth giving a try. So, and then my own personal experience, I've taken some of these medications and I've seen how I've reacted, and I know how I've reacted, and I know how others and I react, and I know that they haven't necessarily reacted the same way that I have. And so I've as I said, I've experienced this myself. So I'm not coming here as someone who's just, oh, this is all, I'm sitting on my ivory tower and I don't really understand this. I've experienced a lot of these symptoms myself. I've tried a lot of these medications myself, and that's given me a different perspective that I hope that authenticity comes out here in this podcast. I want, when we're doctors treating patients, it's often important not to get too personal. And a lot of people would say don't get personal at all. And I think it depends on the person practicing, and it depends on the patient, how much you can share and how much you can't. Well, I'm not practicing now. You're not my patients. I can be completely real and authentic with you and share the down and dirty on this stuff through all this information I gathered. And I hope that makes this more credible and not less credible. And, I just want to say, I do my best to diligently research this stuff. As I said, this is a one-man show. Not only am I doing this entire podcast myself, I've gathered all this information myself. I put all of these slides together. I've done the research. I've checked it. I've tried to validate it. I've used it on patients and seen how they respond. But I'm not perfect. I try to stay up to date as possible. And I have time to now, where you may not. And I hope that this is a shortcut for you so that you don't have to dig through mountains of research. You can come to this podcast and be like, okay, he's not influenced by corporations. He does this research. He's really interested in this. I don't even have to pay for this. I can just listen to my car ride into work and know more about SSRIs than I did before, But like, as I said, I'm just one guy. I'm not perfect. This is not a company. This is not an enterprise where we've got people doing all this work for me. I'm doing it myself. If I make a mistake, let me know. I'll look into it and I'll correct it on air. I will say, I had said this and a listener told me this, and I've looked into it and they're correct, and I've corrected the slides, and the most up-to-date slides are on there. So your feedback will matter. I don't know how big of an audience I'm going to get. I have a lot of time to dedicate to this. I want you to feel like you have input into this. So your feedback, if you say, hey, I'd really like to know about this, could you do an episode on this? I'll try and put that together. If you say, I don't really like how you're doing this, I'll try and make those changes. Or if you say, it'd really be helpful if you could do this, I'll try and help you with that as well. And if you have like individual questions, I'll answer them on the air so that everyone can benefit from that. So I also, and this is something I think a lot of people don't do. I want to list podcasts that I really enjoy. I'm not competing with anyone here. I want you to listen to whatever you like best. I listen to a lot of podcasts. I mean, here's a list if you're looking on YouTube, and I'm going to read the list. These are all my medical podcasts I listen to. I listen to a ton of other podcasts. I love podcasts because I can be working in my garden and have the podcast on. I can be in the shower. I listen to podcasts in the shower, while I'm driving, while I'm gardening, while I'm taking care of the chickens, while I'm cooking. It's something I can have on in the background and learn. But like if there's new stuff from a medical one, I want to be in front of my computer when I'm so I can make those changes to my slides and add that information in there. So I love these podcasts. And so if you're looking for other things or you want to know like what influences me, this is it. And this is I put these in alphabetical order because I didn't want to put any weight to one to more than the other. So the Carlet Psychiatry podcast, I really enjoy. It's a really great general psychiatry podcast. Cracking Addiction. This is one I don't think is well known. It's from Australia. Really good it's addiction medicine host. He's extremely knowledgeable. I've written to them. They've responded to me. If you want to know about addiction stuff, this is the podcast. I'm going to put my own addiction lectures together, but this is a really excellent podcast for that. Curbsider's Internal Medicine podcast. This is just, all purpose, every aspect of medicine. Great topics, great experts. I really enjoy this podcast. Docs Who Lift podcast. As I said, I'm into obesity medicine. These two brothers, they put together some of the best information on obesity medicine. I've listened to almost every episode. I'm going to do some obesity medicine lectures, and it's going to be a summary of a lot of stuff that they talk about in like shorter episodes. But if you want the details, they do a great job, and they're really fun to listen to. Helix Talk. This is a pharmacist podcast. Really enjoy it. They talk about all different meds, and they give like I said, I really enjoy getting that safety information, and pharmacists are great at giving you safety information. So if I want to know about lipid lowering medications, they will break it down one by one, and they don't take pharmacists don't talk as much about like the utility and like the benefits. They talk about more like what we need to protect the patients from. And I really appreciate that. And I like to try and be both. I like to both say, hey, these are great because of this, and I think it's worth taking the risk, but I discuss it with the patient and see if they want to take the risk, but still being mindful about what those risks are. Hidden Brain. This is not a medication podcast. It's kind of psychology done by a journalist, really excellent about just how the mind works and how we think. Longevity by Design. This is more of a science podcast about how to live longer, healthier lives. Really science heavy. I enjoy, I want to have a better health span, which is a healthier life, more than a longer life, a healthier life. And they go into a lot of the science stuff, and it's really good information. Mind Gut Conversation. This is a lesser known podcast. We have serotonin in our gut and our brains. And the host here, he talks a lot about the connection there between like things that we eat and things in our gut and how that affects our mood and vice versa. And something that I incorporate into my own practice. And so I really like listening to that information with that particular connection. The NEI podcast, we all know Dr. Stahl. We all have his books. That's his podcast. Really good podcast, really good information, really good people they have on there. The Psychiatry and Psychotherapy podcast. These are excellent little 10-minute short, if you want, just they talk about one study, really good little tidbits there. The Psychopharmacology and Psychiatry updates. Oh, I'm sorry, I made a mistake there. Psychiatry and Psychotherapy podcast. That's Dr. David Puder. Probably one of the best psychiatry podcasts out there. He discusses meds and therapy. He's a really excellent guy. I reached out to him. He actually helped me come up with how I could do this podcast. He gave me some really great advice. So I really appreciate that from Dr. Puder, and I really love his podcast. The next one, Psychopharmacology and Psychiatry updates. That's the 10-minute blurb one. And then Real Life Pharmacology. This is done by a pharmacist. Really great 10 minutes on he covers one med per episode. So like if you want to know about Zoloft, he has one episode on that, 10 minutes. And once again, from a pharmacy standpoint, safety and so forth. And then where should we begin? That is a couples therapy expert's podcast. I really like listening to her insights about how the human mind works. I think, she is just really excellent with how she kind of formulates and can, do therapy with people. So what are the difference from other podcasts? You probably got it by now. So my philosophy, we went over that. I want to come off as like very authentic, and irreverent, That's why I've got the punk rock thing going on. I got the Good Riddance shirt on. I got the black frame glasses, the mohawk, I want to talk like a real I talk like a real person with my patients. I'm not this stuffy, I think people that meet me think that I'm very like very robotic. I've been told I'm robotic, but I don't think my patients would necessarily describe me that way. I want this podcast to be not just, I want it to be fun to listen to. I want, we're going to cover some information that's sometimes dry, but I want it to be fun. And I want you to feel me in the episode, and I want you to feel connected to me and how excited I am about this information. And, this is how I really talk to people. I'm going to talk, I'm not going to talk like I talk to my, work, my boss and stuff. I'm going to talk to you the way I talk to regular people, friends, family, stuff like that. So hopefully that might be a little bit different than, it's maybe a little less stuffy, a little more fun, the non-commercial nature. We talked about that, no money involvement here, right? The organized lecture format, right? I don't want to go all over the place. I don't want to go from topic to topic to topic. I want it to be like, hey, I feel uncomfortable prescribing antidepressants, or I'm taking antidepressants. And I want you to be able to go to the antidepressants lecture and be like, okay, I got what I needed to learn there. The bottom line is, I want those that practice medicine to walk away from these lectures, or those that will be future practitioners, right, to have the tools that you need to safely and effectively prescribe, deprescribe, or not prescribe the medications that we're going to talk about, right? For non-psychiatrists, I want you to be able to feel comfortable prescribing psychiatric medications. For you mental health folks out there, I want you to feel comfortable prescribing meds that aren't mental health meds, that have to do with mental health. And for patients, I want you, like, maybe your doctor didn't have time to go over something, or maybe they didn't have time to learn about some new study that came out. I want you to have more information for yourself so that, you can make better decisions for like the treatment that you want to endeavor on, So hopefully everyone walks away more informed and with information in a fun way that they didn't have before. So, I mentioned this. Why do all prescribers need to know about all meds? Because I'd say, hey, you non-psychiatrists, you need to prescribe our meds. And hey, psychiatrists, you need to prescribe other people's meds. And I think people don't do that. They stay in, I hear this, I need to stay in my lane. I should stay in my lane. It's like, well, I'm not going to practice surgery. That's, I'm not going to perform a colonoscopy on somebody. But I can prescribe a medication that will help the patient sitting in front of me. I can learn about that medication. I can know about it, right? And I think patients out there are probably thinking, what? All doctors don't know about all medications? They don't feel comfortable prescribing all medications? Or maybe you saw a doctor and you were kind of confused of like, why did they say they couldn't give this to me? Or, and it's hard to learn about all of it. It's hard to have that time. So it may sound like a rhetorical question, but it's not. And I think a lot of you are probably saying, oh yeah, that's all well and good, but I'm going to stay in my lane. Well, I want to challenge that, right? And I want to bring up a couple of points. If you're on an inpatient unit, you've got patients coming to your inpatient unit. You got to manage their meds. If they're on diabetes medications, you're prescribing that. You can't just call every subspecialist about those. And I wouldn't just like just reflexively just give them everything that they were on. Like, I want to know what these meds are. If I'm prescribing a med to somebody, I want to know what it is. You know, I'll see a patient in the ER sometimes and they're on some new med for something that I've never heard of. I take that opportunity to go back and learn what that med is. It's like, oh, what is this? Oh, it came out in 2019. Oh, it was after my medical training and I've never seen a patient on it. I've never heard of it. And it's for a condition that I don't typically treat, but I want to know about it, right? Because I may have to prescribe it to the patient when they're in the hospital. Also, what if there's a drug-drug interaction, right? What if that medication that they're taking that is not something that I'm familiar with is interacting with the drug I'm giving them, or vice versa? Or I'm starting a med that might interact with something they're already on. And then what if the med that they're taking that's the one that I'm not familiar with is causing the mental health symptoms, right? And so rather than adding something else on top of it, maybe changing that med that's treating a different disorder to something that doesn't cause the adverse effect that's causing the mental health symptom. And so I need to know about that med because I need to know what problems does that have? Or maybe two of the meds they're on that are not the ones I'm managing are causing a drug-drug interaction that's causing a mental health symptom, right? So everything's connected, right? And so I think it's important, no matter who you are, no matter if you're prescribing meds, to know about all of them, because I've helped people by treating medical, or they may come in for mental health symptoms, but it's really some other disorder. So it's not necessarily a medication, but it's that disorder that's causing the mental health symptoms and not a mental health disorder. And, I think, you go to a cardiologist, you get a heart med. You go to a GI doctor, you get a GI med. You go to a brain doctor, you get a brain med. I don't practice like that. I think the non-physicians out there that aren't practicing scientifically backed medicine, they've kind of hijacked this holistic medicine term and made it kind of this nebulous thing that oh, I'm, alternative medicines to treat their holistically. It's like, no, I treat patients holistically. And I think great doctors and good they do. You have to look at the patient in front of you. What is going on? Investigate it. Is there something else going on? I treated a guy. They sent him to me for ADHD evaluation, and I end up finding out that he's not sleeping well, and he's not sleeping well because he's peeing all night, and he's peeing all night because he probably has an enlarged prostate. And then I gave him an alpha blocker, and he's not peeing all night. He's sleeping, and his concentration was fixed. And here I gave somebody alpha-zolcin, to treat a completely different disorder, but that was really what was going to fix him. So that's why I think it's important to kind of know this whole thing. And I hope that this podcast gives you better tools to be able to do that. So to end the podcast, I think we've already kind of covered it, but what are the topics? First, we're going to hit psychiatric medications in pretty much this order, because I want to hit them in the order of what are the things that you need to know first the most. So antidepressants, I've already got antidepressants done. I'm going to record those episodes. Then we're going to do ADHD, then we're anxiety medications, sleep disorders, and that's going to be insomnia, sleep apnea, restless leg. I'm going to try and cover the gamut there. Then we're going to go into mood stabilizers for bipolar disorder. We're going to cover antipsychotics for psychotic disorders and mood disorders. And then we'll probably hit some geriatric psychiatry topics, dementia, delirium, Parkinson's. We'll talk about the Beers criteria. We'll talk about start-stop criteria. I'll probably do some episodes on lifestyle psychiatry. That's like lifestyle medicine from a mental health side, and then reproductive psychiatry. So I'm going to cover a lot of women's issues with each of these sections, but I want to do one lecture where we kind of bring it all together. Women in ADHD, women in, we're talking about PMDD, we're talking about postpartum depression, we're talking about menopause and the mental health side of that. And so I want to do an episode about those concepts. And then we'll talk about substance abuse. So we'll go over alcohol and opiates and cocaine and LSD and mushrooms, and we'll hit all of those. And then I want to do an episode on assessing a medical patient or doing a medical assessment. So a psychiatric patient comes to you. How do you evaluate them in an ER setting and like an emergency setting? What labs would you get and when would you get them? And like, how would you do like a really good, but also concise, let's not overdo it. Let's not order too much. Let's not, go overboard here. What do we have evidence for? When do we get a CT? When do we not? And then if we still, I've got a good audience and we're still going strong, I want to go into other medications. I want to cover obesity medications. I want to cover pain meds, thyroid, hypertension meds, dyslipidemia medications. And, I know there's a lot of talk about obesity medicine out there now. So, I mean, I may hit that topic sooner if, there's demand for it. And then also I want to go over allergy meds, acid suppressants, hormone replacement therapy, right? Testosterone, estrogen, progestins, headache medications, constipation, drug-drug interactions, QT prolongations. So hopefully like we really give you a good basic knowledge, a very thorough knowledge on psychiatric medications, and enough to feel comfortable with on some of these other topics. And so that is the end of the first episode. I hope you enjoyed it. I hope I made you want to listen to the next ones. And I hope you'll join me for episode 2, where we start talking about antidepressants.